नमस्कार दोस्तों, मैं अमिताभ and you are watching Ed Talks with Amitabh. एक बार फिर in our episode with a theme to get ourselves aware. And today we are going to talk about something that we are using all the time, but probably ignoring it all the time as well. Something which is most taken for granted. Even right now, when I'm talking to you, I'm using that, and that is my mouth. We whether we are blabbering, whether we are eating, whether we are speaking, whether we are smiling, whether we are building relations, mouth is all important because it is right there in front. When we go in a hospitality industry, we talk about front office, and I think our mouth and our body is our front office, where the first interface is there that people are having. But then I personally feel it is one of the most neglected areas, and that is why today we are going to take up and educate ourselves and make ourselves aware of oral health. And friends, oral health, oral hygiene has been one of the most taken for granted area in general. That's my point of view, and it's not given the same importance. A pain in a chest, even if it is muscular, we're a little more worried and anxious. We say कि कहीं कुछ problem तो नहीं है, but we don't look at a toothache or a pain in jaw with the same intensity. And and least realizing a pain in jaw might be an indication of a cardiac symptom. And there's so much to understand about oral health. And friends, a healthy mouth ensures healthy body, and hence the healthy life. Even when in these Corona COVID times, oral health becomes very very important. Even when we are talking about black fungus and other aspects being talked about. When nose gets blocked, it is mouth that we breathe from. But then, have we given it its due in our health concerns? And that is what we are going to talk about. And friends, while we were concerned at the school times about this as a concern, we thought who will be the right person, and you know, none other than Dr. Utsav Butta. When I talk about Dr. Utsav Butta, he's specialized in oral care, oral and maxillofacial surgery, and he's been helping people for more than a decade now in this field, and really come across as a leading force in the field. And in fact, when I was going through his profile and CV, he's he has already conducted 3,500 implants in a very short duration. He has restored over 10,000 smiles at the group he's working for. He's director of Dental World group of clinics in Kolkata, and it is a Dental World as it's spread all across in Calcutta, and they are helping people restoring their smiles and taking care of their oral health. And Dr. Utsav Butta, he has been awarded in recent times. In 2016, he has been awarded Best Dental Clinic Award in International Healthcare Awards. Most technologically advanced dental clinic, Dental World by Economic Times in 2018. He also received Most Trusted Dental Clinic Award by RMB, Rotary Means Business Connect. That's one of the major Rotary units in 2019, and Doctors Excellence Award in 2019. Friends, let us make use of excellence of Dr. Utsav Butta and understand what we need to take care of oral health so that we can ensure a healthy body and healthy life. So without any further ado, allow me to invite Dr. Utsav Butta, who's waiting, connecting straight from Calcutta. Welcome to Ed Talks with Amitabh, Dr. Utsav. It's really a pleasure having you in our show.
Thank you, Amitabh ji. That was a wonderful introduction, and thank you for inviting me to this show of yours. I hope I'm able to answer to all the queries and put in my thoughts and views and help people as much as possible. Thank
No,
you.
I'm sure it's going to be very enriching for audience, definitely for me. And I know that when we have a problem, the one name that we know where to connect is you, and I'm sure all our viewers will realize and benefit from that as well. Having said this, Dr. Utsav, I would like our viewers and audience who are connected to us on the School Time through Facebook as well as YouTube, and there are some people who are live with us. Some people will be watching it at later time. That's the benefit of on a social media platform, that one can choose the time to view it. So I would like if you can just give us a little brief, because there's so much to talk about you and your clinic that you are spearheading as director.
Yeah. So basically, I'm an oral and maxillofacial surgeon, as you have introduced me as. And the thing is, in dentistry, you see, we have multiple departments, specialities. When we complete our graduation, we are general dentist. We call them as a BDS. But then after graduation, we get the liberty to choose a specialty and then focus on that and super specialize in it. So I took the department of oral and maxillofacial surgery, specialized in it. I further went on to go to Scotland, and I went and took my further degree in reconstructive surgery. Came back to India. I went into dental implants. I help people, restoring their teeth and their smiles in a more fixed and permanent way. There were these old technologies. I mean, not I would not say technology, old treatments which are yet being followed, like dentures and bridges. So that is something which is yet being done. But in today's time, people are looking for more long-term treatment options, and one of them is in dental implants. So I specialize in dental implantology. So that's my core area that I'm taking care right now. Apart from taking care of surgical removal of cysts and tumors, and to that extent even cancer surgeries that I do in the hospital setup under general anesthesia with my team of doctors. Yeah.
Mhm. Fantastic. That's so there's so much to know and understand from you, Dr. Utsav. And while you were talking, I was just recalling about 2 decades back. There was a feature on me in Statesman in the Voices supplement here in there in Calcutta, and they have given the heading "Doctor Feel Good" to me, and they have written there a man painting smiles on human faces. And I think this line is so very true for you now, because you are literally restructuring and reconstructing people's life. Probably we look at the inner self as a psychologist and trying to give that calm so that people can smile. You are literally physically making people smile and restore their smiles.
Yeah, so the face is a communication to people. So if you have a good smile and you got a good, if you're able to structure your face in a much more aesthetic manner, obviously your communication levels are going to be much better than a person who is devoid of that. So that is one thing. And I always have this one slogan that I always keep telling you: you don't get the second chance to make the first impression. So your first impression is your face. Okay, it's of the face value, right? And I see the teeth is one thing. There's a study which showed that if you have a missing tooth and you have an eyebrow which is not there, the first thing that goes in on the missing tooth and not the eyebrow.
Right.
Right. So how important a tooth is. Each and every tooth in our mouth is an organ. We've been taught that since the childhood days and we're in school. So we have 32 organs. So how can one think of not having that one tooth and thinking that everything is going to be fine?
Right.
Each and every tooth helps to maintain an equilibrium. The orofacial system is all maintained by the bites that we have, and any tooth missing can derange the whole equilibrium, the bite system. And if the bite system is deranged, you may have headaches, you may have neck aches, you may have joint problems, because you start chewing from one side, you may have a muscle hypertrophy. It's like you're picking up weight from one hand and you don't pick up weight from the other hand. Your one hand, the muscle they pump. Similarly, when you eat countries from one side, the one side muscles they tend to just bulge out. So you are trying to disfigure the whole system just by not having that one tooth in your mouth. So this is what that importance needs to be spread. We need to think more on these lines, educate as much as possible, and let's hope that we are able to communicate well.
We'll surely try to do that. And very rightly pointed out, चूंकि हमारे पास पूरे 32 है, एक आध अगर निकल भी गया तो क्या फर्क पड़ता है. That attitude is not going to help anyone. We need to give our oral health its due respect because it is connected with your oral health. It's what Dr. Utsav Butta said. Then on a lighter note, Dr. Utsav, just wanted to ask you, ये जो आपकी मुस्कुराहट है आपके चेहरे पे, ये मतलब implanted है or it is the natural one because you have a lovely smile and your first impression is really good.
I,
That's just in a lighter way.
I mean, I don't know how to answer that, but then I guess it's because the people around me, I'm always, accompanied with a good set of people, so they never let me, have a sad face. I would
And
like to give
I
that credit to
totally
my
respect
family,
that.
yeah, and always the
Your
people working in my
personality is
organization.
your personality is reflected through your face, and I think you qualify in that uh, phrase that a lot of people say an apple a day keeps the doctor away. And if the doctor is handsome or beautiful, keep the apple away. I'm sure all of your patients would be feeling that, but that is totally in a lighter vein. You beautifully
Right.
said
Thank you.
that
Thank you.
you don't get a second chance to make the first impression, and your
Yeah.
face is that first impression
Yeah. It's
gateway.
an
So don't
it's an
take it
organ
like
of communication. Yeah.
so. Absolutely, and I really love that phrase, and I would like our audience to understand it. But then we'll talk about more about oral health. लेकिन एक थोड़ा सा जानते हैं. Let's play a small video for the kind of work that you are doing, Dr. Utsav Butta, so that our audience, our viewers, knows about you and the kind of work you are doing to dental world in Calcutta, in eastern part of the country, and then we will come to oral health and inputs on that.
Yeah. Thank you.
Our whole fraternity is under immense pressure during these trying times of the pandemic. The COVID cases are rising at an alarming rate, but that doesn't mean that the other ailments are on a temporary break. It is our duty and responsibility to ensure utmost safety of our patients, and dental treatments come with its own set of challenges. Hence, at Dental World, we are taking all precautionary measures to ensure our patients the peace of mind while undergoing dental treatments.
That was so lovely, and that was so exciting to see the kind of care and caution you're taking at your setups during these COVID times. And this brings
Thank
me
you.
to, I have done my homework expecting you on for the questions, and there were two questions which were there in my mind, and I would like to ask after seeing this video both at one go, and that is, my first question, which is a very natural, obvious question with today's theme, is that how do you see the importance of oral health, and what are the kind of commonly faced challenges that people have? Now, I would like to add a context to it is COVID times. After seeing this video, that becomes a very, very important, relevant context. So, what kind of challenges are being faced, and why is oral health important?
Yeah, very, very, very good question. Actually, to start off this session, I think this is a very apt question. So you see, the oral health is the gateway to our general health. Everything from the mouth, it gets inside to our body. So it's the mouth. And our mouth, it harbors a lot of microorganisms, bacteria, viruses. Most of them are harmless unless and until it is not maintained properly. If hygiene is not maintained to a level, then these microorganisms, they grow to an extent which starts causing problems, or certain conditions or diseases in the mouth. So the common diseases that we would normally find in the mouth would be gum inflammation, tooth cavities, and all these things. So these are very common things. Now what happens is that these bacteria, when they grow in the mouth, they tend to secrete certain acids. Okay, and these acids, they normally tend to cause an attack on the tooth surfaces. They tend to dissolve the tooth surfaces, and they go much deeper down and reach the nerves inside the tooth, and that's the time when the tooth starts to pain. And in the gum area, it tends to cause inflammation, gum bleeding. And if it's gum bleeding, that term is known as gingivitis, very common term that most of us know by in these times. So what happens is that when these bacteria, when they are growing in the oral cavity, they tend to be ingested by us into our system, into our respiratory and digestive tracts. Over a period of time, they tend to cause more bigger issues. So, for example, you may have heard that a person having a very bad oral hygiene, had some of the other heart issues. So it was later on found out that the bacteria which was harboring in the mouth was the same amount of bacteria which was seen in the heart vessels. So basically, what happens here is that if the oral hygiene is not maintained properly, the bacteria, tends to enter into the bloodstream due to the rupture of the blood vessels. So when there's a gum bleeding, obviously the blood vessels are open. The bacteria, it enters into the bloodstream, goes down, trickles down to the blood vessels, and it engraves itself on the inner lining of the heart valves.
Okay.
That term is known as endocarditis. It causes an infection of the muscles of the heart. Now, in due course of time, the heart muscles function, they become less. And then, what happens after that? So similarly, there are some cardiovascular problems also that happens, clogging of arteries. And these clogging of arteries is because of the bacteria that is growing in the arterial walls. So how we need to, how we need to look into this situation? We need to actually solve the cause rather than, solving the problem. The cause is the mouth. In most of the situations, I would not say all, but in most of the situations, the mouth. It is the gateway to your oral, to your general health. So what I normally like to emphasize here is that by maintaining proper oral hygiene practices can reduce a lot of general health problems. A lot. Yeah. And I will be basically discussing on the oral hygiene practices, especially because these COVID times, we've been, having a lot of these doubts. I get a lot of calls from my patients. They tell me about what are the practices that we should be following and how do I, avoid visiting you. So there are a lot of things, and I keep discussing
These
this.
are the kind of
Yeah.
questions we've been pouring in since the time we informed on the social media that you are coming.
Okay. Okay. Good. 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 So again, one thing I would like to put here is, pregnant women. They also should be very, very careful about maintaining a good oral hygiene, because
Okay.
you see the plaque in the mouth, it stays normal unless and until a lady is not pregnant. But the
Okay.
moment the lady is pregnant, the woman is
Right.
pregnant, what happens is that there's a burst of oxytocin and there's a burst of progesterone, these hormones which are
Right.
released in the body of a pregnant lady, which ultimately tends to cause a small thing like a plaque in the mouth can cause an exacerbation of the infection. So
Okay.
initially there was an infection, later on it turned out to be a big infection and causes gum bleeding. And during pregnancy I normally would not want to operate or do any sort of procedure in a pregnant lady, because that would cause more bigger problems. So we tend to see pregnant ladies before they actually plan to have a baby, and they would like to have a proper general checkup or oral checkup. So this is what I normally focus when I talk to my patients. And apart
It
from
is.
that, people, yeah, please, sir.
It is so very intriguing to know, that the oral hygiene and the oral health is so directly connected to cardiac health, or it is directly connected to pregnancy. I never in my dream ever imagined that oral hygiene and pregnancy can be so very directly
It's
connected.
very much. So there are cases where there are low birth babies or premature babies, and the
Okay.
majority cause is because of a bad oral hygiene.
Okay.
Yes, and it's well documented. So this is the reason it's so very important for pregnant ladies to have a check even before they start to plan to have a baby.
Okay.
They should be having a proper oral check done. That's one thing. So also, patients having osteoporosis. Osteoporosis is something which, the very common term that we use these days, osteoporosis,
Absolutely.
it's like it's weakened bones. Now, these
Right.
weakened bones also cause weakened jaws. They tend to
Okay.
have more, mobile teeth. So
Okay.
you see how oral hygiene plays a very important role, so as to reduce the side effects or the harmful effects that could have been caused by an osteoporosis. So it's
Absolutely.
very important, because an infection in the jaws will ultimately result in bone loss, bone infection. And that infection from the bone would go where? It would go into the tooth. And from the tooth, it will, tend to cause more infections and then ultimately tooth loss. So, it's a vicious
It,
cycle. Yeah.
listening to you makes it very clear to me that and that's something which I would like to emphasize for all our viewers, that friends, if ever or if at all we were thinking oral health is or dental science is just about your dentures, I think we are living in a fool's paradise, because it is not just about your denture; it is about your overall health.
Yeah.
And it is connected with almost every part of your body, and the different significant areas which we think are important are also very directly connected with our oral health and hygiene, be it cardiac parameters, be it pregnancy related issues, be it orthopedic context. You know, uh, your dentistry and oral health care plays a very
Very
important
important.
role in the overall health scenario. Just out
Yeah.
of curiosity, did you get? I'm sure you must be getting a lot of interesting cases, and generally, we, as a lay person, when we look at, I have this perspective. When a patient comes to a doctor, we all look at it from our point of view. Cardiac person looks at it from a cardiac person. A general medicine person looks at it from a general medicine perspective. uh, if they come to us, हम कहते हैं भाई सारी चीजें तो टेंशन है इस वजह से आपके you have a psychosomatic parameters.
Yeah.
हम सबका चीजों को देखने का अपना अपना नजरिया है. I think it's very important for being very holistic about it. So do
Yeah.
you get certain cases where you think people have come because they have pain in their oral area, and then you realize no, it is not. They need to
Yeah.
it's another professional.
Yes, absolutely. I would like to throw some light there. So, see, I'd just like to give an example. Just recently, a patient visited me and she was having a tremendous pain in her jaws. I looked intraorally and I did an examination inside her mouth, and I saw that there was not no such conditions which would predict or would diagnose her as an oral condition patient. But then after further diagnosis, what I realized was that she was having a radiating pain to her left hand and even to the back. So which instantly struck my mind that I should be referring her to a cardiologist. I immediately referred to the cardiologist, and the cardiologist then called me from there and told me that it's a very good thing that you had diagnosed because she was going into an attack. She had a half an hour window wherein she was diagnosed. She was, and a proper intervention was done. She went and underwent a cardiac surgery, and she was saved. And there was a 90% blockage of her artery. So that is something which is very, very alarming. So
That's
keeping these things in mind, if we are able to holistically, able to see the problems and relate it to the other problems, I mean, I think you're a winner there. I mean, I'm sure we can get it. Yeah.
such an interesting share that you have, and I think significant for all our viewers to relate, understand from this example that you or case study that you shared, that sometimes we are having problem in our mouth, we are having a pain, and we tend to ignore कि अरे दांती तो है, ठीक है बाद में कर लेंगे. We do not realize the seriousness, and like this lady you talked about, she thought that it is a, I'm sure it may have got neglected in the initial phase maybe, and when she
Yeah.
came to you, it was already a more difficult phase she was in, and luckily she was with you, and
Yeah.
that you referred her to a right professional, and things were taken care of. So friends,
Right.
I am getting this insight that we all need to not take our oral health or oral symptoms lightly, because it can save your life, like it happened in this particular example that Dr. Utsav Butta just now talked about. And
Yes.
Dr. Utsav,
Amitabhji, I would, sorry, I'm interrupting you here because, I would like to share one more incident, which I would not like to miss it out on this platform.
please.
You see, many patients, they have this pain in the head region. They call it as migraine. Commonly, we term it as migraine or headaches or neck aches or joint aches. Okay, so when these type of symptoms are normally incurred and a patient doesn't know what to do and where to go, the first thing that comes to the mind, either they visit an ENT or they would visit a neurologist and try to find out why that pain is there, because related to the head and neck, so it has to be somewhere related to both, or an orthopedic, so doctor. Now now what I have seen in my practice, when these patients, they come to me and I just do a simple diagnostic test known as palpation of the joints. Okay,
Okay.
now there are two joints here which is attached to our lower jaw, and these
Okay.
two joints are suspended by four muscles on each side, and
Right.
these four muscles are actually holding on to the lower jaw. Now,
Okay.
the moment there's a dysfunction or a disharmony in both these sets of muscles, what would happen is that there is a space out here that's known as the joint space that gets
Right.
reduced. And there's
Okay.
that cushion or a disc, we call it, which is highly
Okay.
innervated. Now, that starts to get compressed. Now, when that happens, this nerve supply that supplies all these regions, they get started getting hampered because of the disharmony of the muscles. So what's
Okay.
happening here is, just by having, so again, I'm just going back to that point where a person is having a missing tooth, or a person is having clicks in the joints, or a person having headaches, they don't know what to do, and they just start trying to do some home care remedy, or they go to specialities where they do not know whether they're going to get a solution out of there from there or not,
Right.
and for years and years they get mistreated. Okay,
Okay.
now in these situations, once I diagnose them as a temporomandibular joint disorder patient, we do certain scans for them and we see, and on realizing that they are a TMJD patient, There's a certain set of protocols we follow for such patients, and we relieve them of pain 100%. So those patients were actually having migraines, joint aches, neck aches, and then in due course of time, after we treated them, they're off their pain, which they were being treated by doctors. They didn't know. I mean, they 15 years, 10 years, no pain relief. So this is something which we would, obviously be talking more on. Yeah, I will discuss on this. But you see, this is how we actually associate ourselves directly or indirectly with other specialities outside the the dental fraternity or the dental speciality. Yeah.
Dental specialties as much, it's absolutely one of the branches of the overall medical foray, and that's how it needs to be looked at more holistically. And it's very intriguing. I never realized that, and I think even there's so many friends who complain of headache and migraine, and years they've been taking medicine, but no one I have come across till the time I heard it from you right here, that who looked at it from this point of view that let me go to a dentist for this migraine that I'm having, because and that's where people need to realize that there is a context that needs to be understood. If other diagnosis is not there, get to the right professional and get it diagnosed. And it's so very intriguing and interesting. It's so much to learn in today's interaction with you, Dr. Utsav. It's really fascinating. Our viewers are already appreciating and acknowledging they are finding this interaction to be very informative and interesting. So thank you all for being with us, those who have joined in the live session, and acknowledging. Feel free to ask your questions also, viewers and audience, because Dr. Utsav Butta, a busy professional, a doctor, will is available to us to answer all our questions today, as long as he's there in the time slot that we have. So feel free to ask your questions in the chat box, and we'll try to incorporate your questions besides the question that we have already received on mails and others from our viewers. Having said that, Dr. Utsav, during this COVID time, we are anxious. पूरे मेडिकल सिनारियो में बहुत सारी बीमारियां तो गायब हो गई. पहले just 2 days back I was talking to a friend and I was saying कि भाई याद करो पिछले 2 साल में से पहले 6 महीने में कितनी बार डॉक्टर से कंसल्ट करते थे, और पिछले 1.5 साल में how many times आजकल तो डॉक्टर को कॉल करने में डर लगता है कि कहीं वो ये ना कह रहे कि हॉस्पिटल आ जाओ. That is the kind of anxiety proneness people have. And in this context, I feel that oral health also is affected. So I would like to talk about certain context in COVID context, but then we'll come back to that after a short break, because we are supported by HLS India, which is one of the leading organization for mental health. So let us make people know about that as well in this promo break for them. We'll come back and talk about the COVID context and dental and oral care. While I was going through this video that was played by the School Times team, the words which were there were also connecting me to what you were talking about just now, that stop believing in what they say, because whether it is mental health, whether it is oral health, people say, nahi, theek ho jayega, it's okay, kuch din ki to baat hai. Even, forgive me, but even people like us in the household, किसी को दर्द होता है तो हम भी एक आध एडवाइस तो दे ही देते हैं कि भाई कुछ नहीं, एलम यूज करके थोड़ा सा गार्गल कर लो, सब ठीक हो जाएगा, फिर 2 दिन बाद देखते हैं. We all, whether it is oral health, whether it is mental health, that has been taken for granted a lot by people, but people should not, because everything is important. Take care of your health more holistically, and that's what Dr. Utsav Butta is also emphasizing, that we have to be holistic about our health and not, doctors have specialized to give you special care. They have not specialized to segregate and compete with one another कि भाई तुम्हारा एरिया नहीं है, ये मेरा एरिया है, because बॉडी तो एक ही है और सारे बॉडी पार्ट्स एक दूसरे से कनेक्टेड है. तो हार्ट से होता हुआ अलग अलग पार्ट में वही वेन सब जगह पर ब्लड ले जाती है. So everything is connected, and infection in one area can infect
Exactly.
the other
It's an
area.
interdisciplinary approach. Exactly,
It is
sir. Exactly.
interdisciplinary, absolutely. Now, coming to
Absolutely.
this context, Dr. Butta, about the COVID context, I would like, even if you allow me to share, my son few days back had this, you know, tooth ache, and his forcefully pulled his one of the tooth which had a cavity, and it was, then he was having extreme pain, and he said ki papa doctor se nikalwa do please, he's 8 plus. And I said ha beta bilkul, and I was one of those fearful parents taking him to the doctor. I said ek din aur wait kar lete hain. Right, luckily it came off, but then I had consulted my wife that we had thought of next day to reach out, because it was the previous day evening, so it worked out fine, so we did not go further. And but then what I'm trying to people are apprehensive reaching out. So how are you, what is it that people need to take care of in the context of COVID, even otherwise, when to understand it needs a doctor, and when to understand, okay, we can consult on phone, or we don't need to consult a doctor, we need to take care of it at home. So can you throw some light on that?
Yeah, yeah. So see, we are in COVID times, and I normally don't motivate my patients to, come and show me only and understand it's not an emergency. Now, how do we
Right,
understand that it is an emergency? So I normally would do a video call initially to understand what the patient's problems are, and if I can,
right,
solve it with a course of medicines, I guess that works fine with the first line of treatment. And that's what
right,
been advised to us by the Dental Council of India and the WHO guidelines, which have recent guidelines
right,
which say that. So that's the first line of treatment that we should be doing. And in case if the person's it's an urgency or an emergency category of conditions,
right,
like for example, I can just give you examples like if person is having severe pain, unbearable pain, and the pain is even not coming out with painkillers.
right,
That's one set of. Second would be if there's a swelling in your gums or face. A third,
right,
if there could be bleeding gums or any of the mouth area which is bleeding inside the mouth, then it comes under an emergency situation. Fourth, if people have had previous dental treatments done and there are crowns and bridges and they've come out or they're broken or they causing some sort of lacerations in the mouth, then obviously it should be taken care because then it may cause more problems. And
right,
one more thing that we normally see is, especially when I saw in the lockdown time when we were not functioning, the last lockdown, not this lockdown, the last lockdown when we were not functioning, we had a lot of children who were undergoing orthodontic braces treatment and they were suffering a lot with those braces. So, we see children with braces treatment every once in 15 days or once a month. And that was a long gap of 2.5 months or 3 months, which we didn't see them. So obviously they suffered a lot. So these type of patients are actually welcomed to the clinic to show themselves as an emergency care, and so that we can take care as fast as possible. Now, coming to the question that how we should, whether it is safe to visit a dentist at this time, because COVID times, I get a lot of patients telling me that, doctor, we don't want to step out of the house, like just give me something which, but I can see during that video consultation that person is suffering. I need to see him, if otherwise it will become a disaster. So in such situations, we show them the video I think you just showed, that see, these are the protocols we are following in our clinic, because these are the stepwise protocols we follow for
right,
every patient. Yeah. So in that way, it's more, patients are more comfortable. They get a peace of mind that yes, where they are visiting is safe, and things are going to be, the outcome is going to be better. The treatment outcome would be better. Yeah.
all right. So it's so very interesting and intriguing, Dr. Utsav. Now, is there something called oral first aid, like when we talk about in case of injury, or is there a kind of a first aid that people can do at home?
Yes. So normally in such situations, so the oral hygiene practices, I would like to emphasize there
Right.
now, because that first stage itself is oral hygiene practices.
Oral hygiene, yeah.
So yeah, so the oral hygiene practices, I would normally divide it as a standard oral hygiene practice, and during the COVID times, what oral hygiene practices you should be following. So in a standard oral hygiene practices, one should be brushing his or her teeth twice a day for at least 2 minutes. Now, 2 minutes is important. I see some people brushing for 15 minutes. No, that's not required. And the
Okay.
right technique of brushing is also very important. It should be a circular motion. For the upper teeth, it should be a down to up, from up to down, and for the lower teeth, it should be down to up, circular motion. Similarly, in the inside surfaces of the teeth as well. So this is obviously, explained to the patient in detail when the patient is face to face with the doctor or the dentist.
Right.
The second thing that comes here for standard hygiene practices would be, flossing your teeth at least twice a day, because it's these areas the food lodges, and that lodgement of food we don't realize, and over a period of time they start causing infection and cavities and gum problems. So before that
Right.
happens, we should be flossing. Flossing can be done in three ways. It can be done either with a threader floss, it can be done with an interdental brush, or much more advanced technique is the or equipment is a water flosser. A water flosser is like a small machine where you have to put some water into a compartment. There's a button, you just press that, the jet of water which comes out and cleans all the inaccessible areas which we are not able to clean with our normal brushes or the flossers. So that's a
Okay.
very, very good equipment that one can have. So that's about flossing. Then third comes about mouthwashes. So mouthwashes is also very important and an integral part of maintaining a good oral hygiene. So there's something known as, we normally prescribe our patients chlorhexidine mouthwash in case they have a disease or a condition in their mouth. So we advise them to use chlorhexidine mouthwashes, 0.2%, and that should be done about twice a day for 14 days. This is
Okay.
normal. I can speak that on an online platform.
Right.
Then you have you need to do tongue cleaning. Tongue cleaning is now the most important part here. Okay, so we are in COVID times. Okay, and COVID times, it's we all know that oral cavity harbors these bacteria and viruses. Now,
Right.
most of these viruses that they're harboring in the mouth, obviously we consider the COVID-19 virus also involved in it. Now,
Right.
when this COVID-19 virus they multiply, and then they start going down to the upper and lower respiratory tracts. We are not taking it up, we are not taking it as a precautionary measure. We're neglecting it. If
Right.
we use mouthwashes, if we clean our tongue on a daily basis, we are not allowing this viral load to increase in the mouth. It is the saliva which contains this virus. So
Okay.
you see the nose and the oral cavity, these both are the point of entry. And the
Okay.
virus, the COVID-19 virus, they are in the form of droplets or aerosol. Now they
Okay.
go and they colonize, and and the mouth, it forms a very conducive environment for the
Okay.
colonization to take place. And if controlled at an early stage, can allow larger or greater risks, can sorry, reduce larger or greater risks. So we need to keep this factor in mind and work accordingly. So when patients, they come to me in my clinic and they ask me, doctor, what should we do to maintain a good oral hygiene? And when I ask them that, what do you do apart from brushing, there's nothing else that 90% of my patients would do. So I explain them about for flossing, mouthwashes, tongue cleaning. These are the three important factors that, so, and important. So again, a tongue cleaning equipment, we call it as a, so you can call it as a plastic tongue cleaner or a metal tongue cleaner, whatever it is, but it should be a good quality. It should not be that it's cleaning your tongue to a half-hearted, attempt. Even if you
Right.
trying it as much, because then you may try to harm your oral cavity. So all these things needs to be kept in mind and shown in a proper detailed way once you visit a dentist.
Yeah,
Yeah.
that's
Another point. Coming to the part where you need to maintain, or during the COVID times, how you're going to maintain a good oral hygiene practice. A COVID oral hygiene practice is, oh, you should not keep your toothbrushes in the same tumbler as your family members. That is one thing. If you brush your teeth, you should be, washing your hands with soap or either sanitizing your hands before touching your toothbrush. Third thing is that you should if it's a COVID-19 patient at home or in a hospital premises, that person should be discarding their their mouthwashes, their toothbrushes once they recover from their condition. Fourth should be that in case if the brushes are too worn out and all those, they should not be used. They should be, every 2 months or 3 months, they should be, one should use a new toothbrush. So, these are the things that one should follow, especially during the COVID-19 crisis that we are having.
It's just a question that if somebody has suffered COVID and recovered out of it 15 days back and has not discarded the toothbrush, should he discard it now? I'm asking it for
Yes,
myself.
absolutely, absolutely, sir. Absolutely, absolutely. Because that toothbrush, the bristles itself will harbor the virus, and it may tend to just get you reinfected. There are
Right.
studies on that. Yeah.
All right. So thank you so much. That's so very important. And friends, I'm sure you are realizing how important is oral health in the COVID context. And while listening to Dr. Utsav, I was just connecting certain two plus two together. You know, everyone is talking about take steam. Everyone is talking about gargle. We are talking about nose and mouth. It's the oral area which is there, and that's what he said, that it makes very colonizing, very conducive to colonizing of the bacteria and the virus, and that is where we need to be taking care of it. And we can minimize the chances, because nobody still knows what you know co- corona is. I give in a lighter analogy, वो बचपन में सुना करते थे, पढ़ा करते थे कॉमिक्स में, कहानियों में, इच्छाधारी नागिन, someone who can take so this COVID, this coronavirus has become fairly ichhadhari,
Yeah.
takes the form and the shape. So then, yes, no, we can minimize the possibilities and ensure better health for us and for our family. And you know, to emphasize, I'm asking this question again, though I know you've already answered, but for our audience and viewers, telephonic consultation, for so many other reasons people are doing, even for COVID. One of the first, if somebody is having symptom, we call up a physician and we talk to them on phone, and they prescribe medicine. So how effective is telephonic consultation in oral care?
Yeah. So a telephonic consultation is very important. It's mandatory actually before visiting a dentist, because a
Okay.
dentist would not want to, see a patient without understanding the conditions, especially obviously during this crisis time. So, as I mentioned earlier, only if it's an emergency procedure, I guess the patient should be visiting a dentist. And if it's not, it's just a non-emergency procedure, it's just like a routine general checkup. I guess we can delay it till the time we have, come to a more normal situation.
All right. Okay.
Yeah.
Okay. So it's you, even if somebody calls you up, you would not straight away be calling them to your clinic. You will first provide them a telephonic guidelines, and if required, only
Guidelines.
then they will be called.
Yes, yeah, yeah. Because it's always better, to minimize the contact. You're outside your, as it is, it's in the air. It's an airborne. It's as by the WHO is now considered as airborne. So you see, it's everywhere. But the chances of you, contacting the virus and the viral load in your body is will be much higher if you're outside your house. So it's always
Right.
better to stay inside indoors.
Right. There's one of our viewers who has asked this question, that if somebody is in a habit of taking too much of caffeine, how does it affect the oral health?
Yes, it very much affects in a bad way. I mean, over a long time, if you're having caffeine, these molecules. I mean, these deposits, the caffeine deposits, they would ultimately settle down on your tooth surfaces, and they ultimately erode your tooth surfaces and make it more rough for it to accumulate in a much larger quantity in the future. And plus it allows a lot of these deposits to get into your gums, and you have, so you see, this anatomy of the oral cavity. I just try to throw some light on it. You
Right.
see, the tooth has two parts. It has a crown and a root. The root is embedded in the jaw bone, and the jaw is covered by the gums on all the sides. Now you see the gums are situated 2 millimeters above the jawbone. So that is that 2 millimeter space we call as a sulcus space all around the tooth. That's the area, where you have these deposits. And over a period of time, whether it's food deposits, caffeine deposits, tobacco deposits, whatever, these in due course of time tend to cause gum infection, and from gums the infection goes into your bone, and the bone starts reducing its level. So earlier it was a 2 millimeter, then the bone goes down, it becomes a 4 millimeter. So for example, I'm just giving an example. So they become pockets. And then patients, they normally complain of food lodgement. Doctor, I'm having food lodgement. What do I do? Then I say, just stop your habit. That's the most important thing. If you stop the habits, the chances of bone loss reduces quite a lot. The chances of your infection reduces quite a lot. Again, patients who are not able to clean properly, not able to brush properly, or not able to clean the inaccessible areas, they also, in due course of time, would have infections and cause bone loss. So it is applicable for all those people who are not able to maintain a good oral hygiene. Yeah.
All right. Listening to you, it kind of comes to me that oral healthcare is so very important if it is not taken care of in good time. You're also constantly emphasizing on preventive ways instead of pushing yourself to a point where you have no choice but to go to a doctor. But then it's like we are sitting on a time bomb if we are ignoring the oral health and hygiene. Now, this comes to a question that there's so many people in a profession talking about that everyone claims to be having state of the art infrastructure, or everyone claims to be the best doctor, and people get confused, and also it has been seen over a coffee table discussion, when somebody talks about a doctor, another person says कि नहीं उसके साथ ये उसने ये किया था, मेरे डॉक्टर ने बताया कि ये गलत था. So we get confused which doctor is a better one, and so how do one go about selecting the right doctor?
The right doctor, right? Okay.
Of course, I know you are the one for me, but then generally, how people can make it?
No. You see, when a doctor, completes his graduation, he takes an oath. He takes an oath, the Hippocratic oath. Okay. Now that oath says that you are going to serve to your utmost, your knowledge and your skills to give the right treatment to your patient. So no doctor would like to do anything wrong to the patient. Nobody, at least, and the person who doesn't have a good idea about their subject, I normally feel that they quit from their profession. But what I've seen normally is that a patient doesn't know that whether he should be visiting that doctor, whether he's the right doctor or not. So see, dentistry is divided into 7 specializations. Okay. Now, one of the specialization is what I am into. That's a maxillofacial surgery. My wife, she's a prosthodontist. She takes care of crowns and bridges and smile designing, dentures. So that's her area. So she rehabilitates. The third department is endodontics. We call them as root canal specialists, the endodontists, and they also the ones who do fillings and conservative dentistry. The fourth department is oral medicine and diagnosis, where the doctor is specifically focused on making the right diagnosis along with the radiology equipment. So the clinical video radiology makes the diagnosis more accurate. So that's one department. Then you have an orthodontist who puts braces on the children's teeth, or even in today's time we do braces in adults as well, to align them to the right position so that the bite is right. And then you have another department known as pedodontics, where we take care of only children. So you see, these are the 7 departments that are now. So when a patient is having a problem, say for example, a patient having a tooth pain and doesn't know whom to go, obviously he or she would just go to a doctor, and the doctor then refers the patient to an endodontist or a prosthodontist to get that work done. So in my clinic, in dental world, as the name suggests, we are super specialized clinic. So we have got all specialities in the clinic. So we have an oral medicine and radiologist who does the diagnosis. accurate diagnosis with the team of specialists, and then further on refers it to the specialist doctor who would then take care of that patient. So there we know that the chances of error is minimal, because the skill set is there. You have the right equipments with you. Again, diagnosis is one very important area here. Okay, you can do a filling also, and you can do an RCT also. Now, what is required for that patient is what we see in the diagnostic equipments that we have. So technology plays a very important role here. Earlier in the earlier days, my grandfather was a very famous dentist. He had a 56 years of practice. So in his time, it was more of skill and less of technology, because at that time the technology is not there. Now it's more of technology. I wouldn't say less of skill. I would not like to say that. Skill is equally important. So I would like to keep both hand in hand, 50% skills and 50% technology, because you have a good say technological advancement in your clinic, and then you're able to diagnose it well. So you have a
Right.
microscope, okay? You have a microscope, and I can do a very accurate root canal treatment. But without a microscope, I'm just lost. I do not know whether I'm going the right direction. Okay, so a lot of things are there. I've got a laser. Laser gives me a very accurate, treatment outcome. Then you have an intraoral scanner. You don't need to use those messy impression materials in your mouth. You can just take photographs of the teeth, and becomes a digital format in a day or maximum 2 days. You have the crown instead of waiting for 4 5 days. So you see how fast and how technologically driven a dental profession has become. So I normally focus a lot on that, and we have to stay upgraded with our skill set as well. So I guess a patient should be doing a good homework here in understanding the right doctor. Firstly, what is a specialty that doctor is in, as to whether the doctor is an MDS, BDS. See, I'm not saying a BDS doctor is not good. A BDS doctor of good experience can be as good as an MDS doctor, or better. So it all depends. So a lot helps, with the word of mouth. Patient's friend has got a good work done, very happy, will go and tell. So a lot of these things do work. So I can't actually just be very specific on who's the right doctor, but
I totally understand.
at least as a whole, I have been able to throw some light on saying that okay, which are the departments, and if you have a certain problem, you can go on to that department, or you can ask your doctor that, doctor, please let me know, if I need to go for a crown. So if you could please, ask a prosthodontist to do my crown, I think that would be I would have a better outcome. So that's
It's
how
it's not just about the individual. It's about the facilities, the technology, and the skill both being put together, and the word of mouth. The reputation of the uh,
yeah.
setup or the individual makes a lot of difference, and the
Yes.
referrals are the best way there. And my referral, there's a big shout out for Dr. Utsav Butta, and I can see a lot of viewers and audience are
Thank
there
you.
with us who seems to be having benefited from you at different point of time. A lot of people are sharing their experience and acknowledgement for you having helped them, so which is great. And before it's really time has flown today in our interaction. But then there are two questions from our viewers I'll take before we call it a day for this interaction. One is one of our viewers, Neha Upadhyay, writes, "How about oil pulling?"
Yeah. Okay. So oil pulling, again, it's a very tried and tested, method of, getting rid of your oral conditions, but not to the complete. I mean, I would not say this to be uh, a, a treatment objective. I would just like to say that yes, you can prevent to a certain extent, but if there's a problem, then you have to visit a dentist. So that is one thing. I get a lot of patients asking me, "Sir, we are doing oil pulling and it's helped us a lot." I said, "Very good, it's good." But then, unless and until it doesn't, if oil pulling is also not helping you, then you have to, go
So
and visit
it
a
is
dentist.
it is good as a preventive mechanism, but if you have a problem,
Yeah,
visit a doctor.
yeah, exactly.
There's Sumanta Tosh has asked a question that what's the best way to prevent having tonsil stones? Is this somehow connected to dental health?
See, that is a very, a subjective question. I think a better answer would be given by an ENT surgeon on this, rather than me just giving half-hearted
All
information.
right. So this is
So I
somewhere
guess,
one
yeah,
should consult
an
ENT.
ENT.
Okay, fair enough.
Exactly.
That's what is important. That's what you emphasize, that we should visit the right professional
Yeah.
at the right time for the right
Yeah.
diagnosis.
Right.
One question, because a lot of viewers on our episode uh, are parents, teachers, mothers are there who are our viewers. In our statistical analysis, about 60-65% of the viewership is female on our channel, Dr. Butta. And so, what advice you would like to give to parents about the oral care of children?
Of children?
Yeah.
I didn't get you. Yeah. Okay.
What
Yeah.
should parents keep in mind for children?
For children, yeah. So yes, good question. For children, so basically, what I would like to focus here is, uh, so children of various age groups. That's also a big question here. Like whether a child is of say 6 months, 1 year, a child of 3 years, 6 years, 12 years. So a child of that small age, between 6 months to 1 year or 2 years, the parents have to be extra cautious because this is a time where children their teeth are erupting, the primary teeth, the milk teeth are erupting in the mouth, and these teeth are very porous in nature. If not clean time to time, can cause a condition known as rampant caries. Now, rampant caries is a cavity caries lesions that are seen in all the teeth. So I've seen a lot of parents coming to me after all the teeth have been affected, and then I have no other option but to admit the child in the hospital and under general anesthesia treat them. A child of 3 years or 4 years or 2 years being treated under general anesthesia, that itself is like it gets tremors. But you have to do it because the child is suffering, the child is not eating, the child is not able to drink. So and the facial disfigurement starts happening because it's the teeth and the jaws which suppose the oral structures. So you see,
Right.
it's very important for a parent to understand from a very small age of the child that once a child is the first tooth erupts at the age of 6 months, it is from
Right.
then the parent should start making the child see a dentist, and the dentist would then know, okay, fine, everything is going in the right track. So you see, those children normally don't have much issues. So
Right.
I would normally suggest, so a parent would should be basically cleaning the teeth after every meals. Once the child is say about 1.5 years old, when most of the primary teeth have erupted in the mouth, 1 year I guess, yeah. The parent should be using a very soft baby bristles toothbrush, and with a pea-sized toothpaste on it, should be brushing at least after every meal.
Okay.
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 After every meal, this is very, very important. Now, parents normally they do it once a day. No, it should be after every meal, and say in between when they take their mid snacks and all that. There, the child should the teeth should be cleaned with a soft cloth. uh,
Okay.
it should be damped, a little bit wet, and then it should be cleaned. So in that way, at least the parent is sure enough that okay, fine, the cavity progression will not take place. Now comes here the tongue cleaning part. Now we're talking about COVID times. Even children are being affected. But tongue,
Right.
as I told you, harbors maximum of the viruses in the mouth. So we
Right.
should be able to clean the tongue properly. So what the parent should be doing with the index finger, the mother should be pressing onto the tongue, and with a baby we get these tongue cleaners, babies tongue cleaners. So with that it's very easy to clean, just press on the tongue and clean. So two strokes good enough to remove most of the microorganisms which are creating an environment in the mouth, yeah.
All right. That's so very insightful. I'm sure a lot of parents can benefit from that. And I could see as our discussion is building, our audience is becoming even more active, and I'm full of questions popping up. But then all our viewers, we have a time constraint, and Dr. Butta has commitments to take care of patients as well. Maybe I would request that maybe we would take up on whenever he allows us time and announce 15-20 minutes on a specific theme, and take him live and answer your questions on that. But then today we have a positive time. But one last question, Dr. Butta, and that is, black fungus is a buzz now as we are taking grip of second phase of COVID. Suddenly the black fungus is taking the center stage along with COVID. So, what guidelines and what would you like us to know about
Yeah, so black fungus is also known as mucormycosis. I think most of people know because in the news it's very evident nowadays that talking a lot about mucormycosis. So basically, it's an aggressive fungal growth that is normally seen in an individual who's immunocompromised or who has less his immune system levels are compromised. So in such patients, normally, we would patients who have especially recovered from COVID situation or are in active COVID situation, they are at very high risk
that?
due to
Right.
the reasons of the immunocompromised levels. So the black fungus, so normally would be seen in the palate side in the mouth, and may cause mobility of the teeth. It also may cause gingival abscesses and even exposure of bone. Now the worst part about this black fungus is it spreads. Now when it starts spreading, it spreads rapidly. So it's
Right.
also known as rhinomucormycosis or rhinocerebral mucormycosis. So
Okay.
what do you mean by rhinocerebral? So there are four variants to this black fungus. Uh,
Okay.
the first variant is the rhinocerebral mucormycosis. Now this is the one which we are more concerned because it's in the head and neck region. So
Right.
this starts in the sinuses region. It goes on to the nose, to the eyes, and then it finally reaches the head if left untreated. So what happens if it reaches to the eyes and the brain, then it is lethal. So here an interdisciplinary approach should be taken. The diagnosis should be done ASAP the moment the patient sees a black growth or a patch on the palate, especially if
Okay.
a person is having COVID or is being recovered from COVID. Now, why is it that these patients are the one who have been affected? Because their immune system is down. Their levels of, say, they're all diabetic patients. So patients who want steroid therapy. Steroid also causes diabetes. They make the patients diabetogenic.
Right.
Steroid
Right.
therapy, even antibiotic courses that have been given during the COVID time makes the
Okay.
person's immune system completely collapse. So it takes a lot of time. It takes at least 2 months, 3 months for the person to, get his immune levels back. So,
Okay.
these 3 months are a very crucial time for a person to be very, very careful and be safe from this disease. Now, if in case if the nose and the eyes and the brain has been involved, then obviously it's an interdisciplinary approach. If it is only in the palate, then
Right.
a proper antifungal therapy should be given to the patient. Obviously, that is case to case subjective, which I can't specify right now, the
Right.
drugs, and also surgical debridement or surgical removal of that lesion if required. Yeah.
Absolutely. Thank you so much. There's so much to learn, and the way our audience is getting involved in this interaction, asking more and more questions, I realized that they found interacting with you very insightful, and they feel that they can get answer to a lot of their awareness issues about oral health and general health as well. So thank you so much, Dr. Utsav, for being with us today. Your final word with our audience today.
So, yes, I mean, I hope this session has been fruitful for everybody. I'm sorry I was not able to attend to the questions, all the questions that have been asked, but I'm surely, I would love to, take those questions offline and answer to all of them. Uh, I just like to say one thing. Please don't neglect your oral health. Again, oral health is the gateway to your general health. So if this is good, your general health is good. We ignore this all the times. I mean, I don't like to blame patients for this. It's just a little bit of education or awareness that we need to spread here, and I'm sure things are going to be just as good as we all want it to be. Okay, so we all want to stay away from this COVID scenario. We want to be happy and safe, and I pray to God that we all get away from this situation and these trying times as soon as possible. God bless you
Thank
all.
you so much for profound words. And if people want to get in touch with you or with your setup, your team, what would be the right way to get in touch with them? It's a dental word. clinic.
Yes, I have. So we have our Facebook links. I'll just share that, and as well as I've got my phone number, my personal contact number is also there. I'll share that as well. We've got a WhatsApp account as well, so you can, if you want to send some messages and know some details about oral hygiene, I can obviously
Perfect.
give my views on it.
So the moment we get
Yeah.
that with you, we will put them in the chat box. So viewers who are watching us, after this session gets over, we are going to post the contact details for those who haven't yet got your question answered. As Dr. Butta said, that they have the WhatsApp reference number as well. You can get in touch and get your queries answered. So thank you so much for such a
Thank you.
informative and very thought-provoking session. Friends, as Dr. Butta said in the beginning, that there is no second chance to make the first impression. So do take care of what helps you smile and make that first impression. And as he said towards the end, that it is very important that we take care of our oral health, because that is the gateway to our overall health. And so please take care of the gateway to ensure that preventive caution and curative measures both for your oral health. Thank you so much, Dr. Butta, for being with us.
Thank you, sir. Thank you. Thank you so much. Thank you. Thank you so much, everybody. Thank you.
Friends, you were listening to Dr. Utsav Butta, Director, Dental World Clinic, chain of clinics in Kolkata, the eastern part of India, but online consultations from anywhere across the globe where you can get connected and take help. We will be putting the details as he mentioned in the Facebook as well as in the YouTube chat so that you get those details and connect to get more answers. I hope you found our session informative and educative and you enjoyed being with us. We'll keep coming every Monday, 5 p.m. at Talks with Amitabh. I hope you are watching all other programs of ours, be it at Talks with Amitabh on Monday, Creative Times Tuesday at 5 p.m., Sahitya Anjali, Tera Tujhko Arpan on Wednesday, Match Debate, which is on Thursday, which is now going to have season 3 with the all international episodes, is getting the time is getting changed and the day is going to be on every Saturday 5 p.m. We will be bringing all these interesting programs to educate and make you aware. Stay tuned and keep watching the School Times. This is your friendly psychologist Amitabh Mohan signing out from Ed Talks with Amitabh.